Hello and welcome back to Ask Your Pharmacist, where we're shining a light on the amazing work being done at the UK's pharmacies and the massive difference they can make to all our lives when it comes to our health and to our well-being. This series focuses on what you can and perhaps should be doing when you approach your local pharmacist. I'm Mike Young, and our expert Suki Basra is once again alongside me, someone who's been working as a pharmacist based in central London for close to 30 years. In this episode, we'll look at some of the common illnesses and what a pharmacist can do to help treat us. Suki, talk us through some of the perennials then, the common illnesses that people don't realise you can indeed should go to your pharmacist about.
So you've got your coughs and colds. I would say you've also got eye infections, which make no difference at what time in the year and take up a lot of GP appointments, to be fair. And that can easily be resolved within a pharmacy setting. You've got common urinary tract infections, so UTIs, that are not complicated. You've got sore throats. You've got infected skin, impetigo, shingles. For young children, you've got earache. So there's quite a few things that can actually be seen by a clinical professional without a doctor's appointment, without waiting on the phone for 2 hours to get an appointment, and actually can be just seen in your pharmacy, your local pharmacies.
What are some of the wrong ways you've seen and heard people treat these sorts of conditions? That there are going to be some home remedies, I would have thought, for sure.
Yes, you're right. I think sometimes it's just misdiagnosing one's own condition and misunderstanding what they're trying to treat. So perhaps a young lady has a urinary tract infection and she thinks she's got thrush. So it's just understanding the differences between the two conditions. And unfortunately, if you Google too much, you can also think that you have some sort of horrific disease, and putting all of that information into context is really important. And I find that as a community pharmacist, I am sometimes just correcting misinformation. Yes. So you'll have, and it happens with all age groups, perhaps more so with those people that use Google as their resource, but then trying to put that information into context and educating the individual based on their own symptoms. Seeing someone is much more useful than just perhaps listening to someone and then not really assessing them properly.
How fascinating that essentially in your career of 30 or so years, the rise of the internet, the rise of social media. I've worked as a journalist for much the same time frame, and the battle is to try and make sure that the truth is out there, correct details are out there, and medically that's so vital, and that for you now, people will be frankly Googling away and misdiagnosing themselves.
Absolutely, and it's important that people get the correct information that's relevant to them. So things like coughs and colds, again, we've touched on that before, but the need for an antibiotic sometimes is just a go-to response. And if you do need an antibiotic, within a pharmacy setting, a pharmacist can make an assessment and decide whether that sore throat does necessarily need that antibiotics. They'll know what questions to ask. They'll know the time frame of a condition. Is it self-limiting, which means will it resolve itself? And as a patient, we need to empower our patients, and that's what we tend to do. We tend to teach our patients, how long do they expect that condition to continue? Will it resolve itself? What things can they do to relieve the symptoms? Because sometimes once you've got a cold, you can't stop the cold. You can treat the symptoms, and that's what you're coming into the pharmacy to perhaps get, some sort of relief from your system, whether it be a sore throat or whether it be a chesty cough, but also knowing at what point do you need to then see a GP. And that pharmacist can make a lot of those assessments for you without you being too worried, because you've got a medically trained or clinician at your disposal to make those judgments more sanely and more with a bit more knowledge, basically.
Oh, I think it's a vital cog in the wheel, really, and the fact that you're able to wave a flag and say, and now go to your GP, you need to go and see someone further about this particular symptom. But that range of symptoms, as you say, I mean, I hesitate to ask you, okay, then someone comes in with a common cold, what are you going to do for them? Because one imagines that could be something like a paracetamol to bring down a fever, for example. But what are the ways that you would look at treating a sore throat, a common cold?
I think some of the basics have been lost within our communities. So our basic knowledge of how to keep well has sort of lost its way. Basic hydration is really important. People underestimate the power of water. They get very chesty, their rib cage aches, and they say, oh, I feel awful, I ache all over. And a pharmacist will question them. And I find that myself lots of times. And I say, well, how much water have you been drinking? Oh, I don't drink very well. Well, I will then sort of try and articulate that actually in normal circumstances, you would need a set amount of water to stay healthy. When you're in a cough or a cold or a fever, you actually need double that amount of water. So if you're not even reaching your standard hydration rates, you are going to suffer. Your chesty cough will become very sticky and hacking, and then you'll feel that you can't relieve your chest and you're finding it difficult to breathe. You'll start getting headaches and you're feverish and you won't be able to overcome the virus. A fever is present when there's a virus. That's your body's own natural way of killing the virus. You're building up the temperature in your body to kill it. Well, if you're not hydrated well enough, how are you going to be able to overcome that, use that heat energy to kill that virus naturally? Because there aren't 101 antiviruses out there that you can pop a pill. There isn't a pill for every condition, but there are things that you can do to help alleviate the symptoms because they will eventually get better.
You've talked about the urinary tract infections, the UTIs. What's the sort of treatment that you would offer there at the pharmacy level?
So within a community pharmacy setting, an uncomplicated urinary tract infection, which is someone that's just got the simple symptoms, you know, they're going to the toilet really much more often than they used to. Even at night they're having to go, their urine is cloudy, there's a burning sensation. All of those simple solutions, and most people do know when they've got a urinary tract infection, but a pharmacist will still question to make sure there is no blood in the urine. They'll look for those red flags, and if they feel that it's something that can be treated within the pharmacy, they have this ability to prescribe antibiotics to treat it, a very short course that will then alleviate the symptoms. The same antibiotics that you would most likely get if you had to book a doctor's appointment. So a pharmacist is trained in order to make those clinical judgments of what's appropriate for that individual.
There are other conditions that maybe we're learning a little bit more about, becoming a little more aware of. I think of shingles, and that may be something that maybe people have learned a little bit more about in more recent years. That's going to be a condition that you can help people with in the pharmacy.
That's right. That's already a condition that we can help within a community pharmacy setting. So a patient can present physically with a blistery rash, raised temperature, painful to touch. They may be slightly older. They've come into contact with their grandchildren who have perhaps passed on. They've had chickenpox. There are all manner of sort of scenarios which could make you subjective to it. You may have been really run down. You may have had a really bad cold, and then your immune system's quite low and you've been triggered. Something can trigger it off. A pharmacist is trained to be able to recognise those signs, look at those symptoms, ask the relevant questions, and then they can prescribe an antiviral, acyclovir, not necessarily just a cold sore type of cream for the old cold sore on the lips, but more substantial systemic treatment.
Suki, thanks for now. We've talked about some of the treatments, some of the conditions. We'll burrow down a little bit more into some of those medicines and how they work in our next episode. Ask Your Pharmacist is a Broadcast Revolution production for the National Pharmacy Association.